today with you findings about the exciting use of big data and data mining in healthcare. Some highlights of what we'll be discussing today include cloud computing. This is where we have cloud service providers. Just as we have internet service providers, we have cloud service providers, and they provide storage, security, and also services. Parallel processing, that's where we use many computers at the same time to accomplish a task. It greatly reduces processing time. Artificial and machine learning, that's where we also decrease the processing time and we greatly expand the capability in our data processing. Today we have literally mountains of data. This is primarily from the ARRA's high-tech initiative and the electronic health record system. We've heard of terabytes, but now we have petabytes. Over 500 petabytes of data in 2012. That number is expected to increase to 25,000 petabytes of electronic data. That's roughly the equivalent of 500 billion file cabinets worth of paper health records. Kaiser Permanente alone has over 9 million members, and it generates 44 petabytes of electronic health data. We do have new technologies developed in data storage, privacy, security, and applications, but there's more work to be done. Big data technology. Parallel processing uses clusters of machines. Google has developed specialized applications to do this. Some examples are Hadoop and MapReduce. You might have heard of those. Specialized statistical applications are being developed for specific fields. For example, genomics and gene therapy. Each field is developing its own user-friendly application so that healthcare professionals can accomplish this in their normal workday. Let's see, public health agencies is another example. They have developed complex programs using a variety of data from economics, ecology, health data in a variety of formats, socioeconomic data. They've developed sophisticated infectious disease control vector models using this big data and data mining. Artificial intelligence and machine learning is used to help incorporate a variety of data. For example, quantitative lab results can vary widely. They have different standardization protocols and calibration methods. So this is an area that we're working on. Text interpretation of clinical notes, audio notes, imaging data using a variety of formatting, and even social media data is being utilized using commercial applications. And modeling techniques provide better predictions, better prognoses, and we're able to accomplish this with the techniques available with the cloud computing, the artificial intelligence, and the machine learning. Privacy and security. Cloud services providers, they do have a dedicated security team. This is great. It offers a cost-effective solution for large and small enterprises. It incorporates HIPAA's 4 rules of privacy, security, enforcement, and breach notification. It also includes security standards and frameworks such as ISO and HITECH. They do incorporate the ONC's and the Department of Health and Human Services privacy and security considerations such as the scope and granularity of private patients' choices, their options for sharing. It includes the methods for revoking permission. It includes applications for electronic signatures. And it also includes something called S4S, Sync for Science, where patients can elect to share their data for scientific research. Healthcare improvement examples. One example is hypertrophic cardiomyopathy. It was very difficult to diagnose in the past because it had so many different variables, but the use of big data and data mining has allowed better prediction models to diagnose the disease, and it's saving the lives of many young athletes. Another example is better readmission prediction using modeling, able to determine which variables to monitor. And now we're incorporating electronic collection methods using social media apps, and this aids in case management as well. Public health agencies can identify disease vectors to help decrease the spread and also implement early alert systems to control epidemics. One hospital in New Jersey used geographic information systems and hospital records to find why their emergency room was overutilized, and they developed strategies to help patients use less costly and more convenient healthcare settings. More about cost reduction. In 1960, we spent $27.5 billion in healthcare. That was a lot back in 1960. But by 2019, that number is expected to reach over $4.6 trillion, quite a hefty sum. And it has been estimated that there's a potential $300 billion to be saved using big data and data mining, according to the ARRA. Automation of processes and operational procedures can be made more efficient. Better decision matrices can be developed using utilization review information and quality improvement data. It increases the time savings. It increases the revenue through marketing and customer satisfaction campaigns. It decreases fraud. Fraud alone accounts for 10% of expenditures. So 10% of $4.6 trillion would actually be well over 300 billion. It'd be 460 billion. So again, this is a conservative estimate. And the reason why is because currently we're utilizing only 15% of the available data. We need better utilization techniques, including quality standardization and also better storage methods. So to summarize, big data and data mining in healthcare is very useful. It provides better diagnoses, better outcomes. It increases the quality of healthcare. Doctors get real-time data. There are better visual displays available. Patients tend to get more involved in data quality and in release inputs. It decreases cost. It increases revenue. It allows new discoveries to be made. Exciting work is being done in gene therapy and stem cell research. The volume and the variety of data, combined with the decrease in processing time, yields better prediction models. And we do need better standardization techniques, especially calibration methods. We also need better data storage and exchange technologies. We are using clinical repositories and also data pools, so work is being accomplished. One ongoing challenge will be data privacy and data security. Thank you very much for listening, and I hope it was a bit entertaining and you learned a little bit also. Thank you so much.